I'm Nurse Cathy. This week I'm spending some time with my family, so I'm away from the office. But I also want to spend just a few minutes with you. The past couple of weeks we've been talking about annual wellness exams and the importance of getting those completed and also preventative screenings. Now this week I want to talk to you about preventative screenings, and the one I want to focus on is the one that we probably dread the most, and that's our colorectal screening. It's recommended by the United States Preventative Screening Task Force that these screenings begin at age 50, continue to age 75. But I will let you know that as of 2019, the American Cancer Society is recommending that the screenings begin at 45. There's several different types of screenings that can be performed. 3 of those are non-invasive screenings, and they can be done at the comfort of your home. First one is an FOBT test, and that is a fetal occult blood test. And what we're looking for in that screening is whether or not there's blood in the stool. Very easy to obtain. You obtain it, take it to the lab. The other tests that are non-invasive that are available are the Cologuard, and I think we've all heard about that through the commercials, and then also what we call FIT tests. Both of those tests are not only looking for blood in the stool, but they're also looking for the DNA cells. And the DNA cells are cells that show cancer or presence of polyps. Now, if any of those 3 tests would test positive, either for blood or the DNA cells, your doctor's going to recommend that you have a colonoscopy done. The FOBT test is performed annually along with the FIT or the FIT test. Cologuard is good for a 3-year period of time. The last 2 type of procedures that can be done for screening are a sigmoidostomy or colonoscopy. These are both considered more invasive procedures. They do require you to go to a facility, have a doctor do the exam, and also requires a little bit of sedation, so you'll have an anesthesiologist in the room. With the sigmoidostomy and the colonoscopy, both require that a flexible scope be inserted into the rectum. With the sigmoidostomy, the doctor will examine the rectum and the lower bowel. With the colonoscopy, the doctor will be able to go up further into the bowel to evaluate. The actual procedure for the sigmoidostomy and the colonoscopy really do not take that long. The bowel prep is far worse than the actual procedure, but be aware that when you have the procedure done, you will have to have someone drive you home because you are receiving some sedation. Now, the sigmoid is recommended every 5 years and the colonoscopy every 10 years. Now, should any of the testing that I've talked about show any kind of positive results, your doctor's going to discuss with you what the next step will be, and he will also probably recommend that the screenings be performed a little bit more frequently than what are the standard recommendations. Colorectal screenings have helped diagnose thousands of people every year. So see your doctor today, discuss it with him or her, and see what screening is the best for you. So this is all for me. Hope you have a great weekend. Be sure to email or call me if you have any questions or concerns. I'll help you. And don't forget Ashley on Monday with Beyond the Table. She's going to talk about summer salads.